healthcare has been one of the most divisive issues in American politics for decades.
This is Dan Diamond, a national health reporter at The Post. Having covered several presidential elections, he is acutely tuned into the powerful role of healthcare in campaigns, past and present.
Democrats think healthcare is one of their strongest issues, if not the strongest issue.
But this is a healthcare crisis. This is a healthcare crisis.
There's reproductive health rights.
I absolutely support reinstating the protections of Roe v. Wade.
That has been something that Kamala Harris, Tim Walz have been running on. The push for lower drug price costs. And then campaigning on the Affordable Care Act.
The plan has to be to strengthen the Affordable Care Act, not get rid of it.
The health law has been a rallying cry in recent elections. And then Republicans still think on some level that criticizing the Affordable Care Act is a winning message.
Obamacare was lousy health care, always was. It's not very good today.
Senator J.D. Vance, the running mate of Donald Trump, has floated a number of healthcare ideas recently.
We also want to make the health insurance marketplace function a little bit better.
For Dan, this tension is very familiar, but it's also revealing.
Part of it is a feeling of being stuck in Groundhog Day. Any conversation about the Affordable Care Act just plays back on themes and fights that happened 5 years ago, 10 years ago, almost 15 years ago at this point. Some of it, too, just shows the divide in our country. The question about whether abortion access should be something available nationwide or not, that was a fight that many people thought had been settled decades ago. So the fact that it is shaping so much of our politics today shows how persistent these fights remain.
From the newsroom of The Washington Post, this is Post Reports. I am Martine Powers. It's Thursday, October 10th. Today, we're going to cut through the noise of all the campaign rhetoric on healthcare. You've probably seen the attack ads, heard the promises. But what would former President Donald Trump and Vice President Kamala Harris actually do to make healthcare better for the average American? We're going to sit down with Dan and discuss that. But first, we're going to start with a look at how the politics of healthcare have evolved. So Dan, before we get into the current election, just to zoom out for a second, you said that healthcare has been one of the most divisive issues in American politics for decades. And I'm wondering if you can give a little bit of context here. Like, how have we seen healthcare decide elections?
This was the issue that Bill Clinton in the early 1990s said he was going to address, that he was going to overhaul American healthcare. He put his wife, then First Lady Hillary Clinton, in charge of an effort to overhaul the healthcare system.
Hello, this is Hillary Clinton. I want to thank you for letting me speak with you about an issue that is central to our children's future.
And that completely blew up in Democrats' faces. It became a black eye for that administration. And one of the reasons why Newt Gingrich and the Republicans were able to win Congress in 1994. That scarred Democrats.
Now is the time to finally keep the promise of affordable, accessible health care for every single American.
There were Democrats who took the plunge with Barack Obama, voted for the Affordable Care Act, and then were defeated in 2012. It helped usher in Republicans' control of first Congress and then the White House.
Yeah. And then I remember in 2016, this was Trump's whole initial platform, right? When he ran on essentially trying to get rid of Obamacare.
Healthcare was a big issue. You had Donald Trump running and winning in part on his pledge to repeal Obamacare.
Together, we're going to deliver real change that once again puts America first. That begins with immediately repealing and replacing the disaster known as Obamacare.
Then came 2020, which was very much a healthcare election, though not on the Affordable Care Act. It was a COVID election, a pandemic election. And Donald Trump lost that election in part because a lot of Americans felt like he did not do a good job responding to the pandemic. So those two elections healthcare felt, to me, much more front and center.
And then thinking about this current moment, what have you and your colleagues been hearing from voters about how much healthcare is an issue for them as they decide who they're going to vote for now?
It has found its way into this election cycle. There were several moments at the recent debates where healthcare came up, but it hasn't dislodged, at least in my mind, some of the other issues that have taken really the forefront for voters. I was out in Ohio, I was out in Minnesota doing some reporting recently, asking kind of voters on the street, what matters most to you? And it's stuff like the economy. It's stuff like immigration. So healthcare finds a way into these conversations, and people do mention the high cost of drugs, for instance, or their concerns about reproductive rights. But beyond the economy and immigration, there also are the conflicts overseas, the conflict in the Middle East. There are so many resonant issues bumping back and forth that healthcare has had a harder time this year finding purchase.
Though you mentioned one, what I might call an exception to that, or an issue that is top of mind for a lot of voters, and that is abortion access, reproductive health care. I think a lot of people think of that as more of a legal issue, an issue of our rights, an issue of the Constitution, but it is, of course, a health care issue as well. What have you heard from voters about how and whether reproductive health care is like top of mind in how they're thinking about the election?
Totally true that reproductive health rights are a major issue, especially to a significant portion of the electorate. I think if you look at the overall landscape, there clearly are many voters who feel that abortion is the most important issue on the agenda this year. In the most recent tracking poll from KFF, a nonpartisan healthcare polling and research group, 7% of registered voters said that abortion was the most important issue for them, compared to, say, 12% on immigration or 38% on the broader economy. So there are other issues that have taken precedent in the broader presidential campaign, but there are many voters who feel that the difference between a Kamala Harris presidency and a Donald Trump presidency on this issue should be the deciding fact on how they're going to vote this year.
Can you describe a little bit how the Harris-Walz campaign is trying to use abortion access from a healthcare perspective as this like powerful motivator for these voters? Like how they're talking about it, the images that they're describing and the scenarios people are faced with?
So I think what you see is twofold, Martine. First, the Harris campaign is continuing the vow that President Biden has made. If Congress passes a law that would restore the protections of Roe v. Wade, President Harris would sign that into law. Now, I don't think that that is legislatively likely in the near term. It would require majorities that Democrats are unlikely to have. They might not even have control of Congress next year. But there are other things that the Harris campaign says President Harris would do. One is the administrative power that she would have through the White House. President Biden has tried to do this already in states that have rolled back protections for abortion access. The Biden administration has said there is a federal law related to emergency care that takes precedence. If a woman needs an emergency abortion, that abortion is supposed to be provided by the hospital, by the doctors in that state. It has become a major legal battle. The Biden administration is not backing down on that. You could see the Harris administration continuing to push on that sort of effort.
The Trump administration, on the other hand, might not be so aggressive. If anything, probably unlikely to be aggressive on pushing for emergency abortion protections. It's notable, though, that Donald Trump himself has reversed some of his hardline anti-abortion rhetoric from 8 years ago. He has said that the fall of Roe v. Wade has returned the issue to the states. He has acknowledged this publicly, that this is a political loser for Republicans, that there should be some rolling back of some of the abortion fight and tacking more to the middle. I think he's doing that because he realizes the political stakes. And we do know that when he was in office, he was a major ally to the anti-abortion movement. So folks are keeping that in mind too.
So, as you said, the Harris campaign sees this as a potentially winning issue for them. But I'm curious, beyond abortion, what is Harris's healthcare agenda, and how does that compare with what we're seeing from Trump?
Harris is running on a number of healthcare ideas that were started under President Biden. One is the reforms to how drugs are paid for, particularly by Medicare. There are many seniors who have complained about the high cost of their prescription drugs. The Biden administration has moved to cap those out-of-pocket costs at $2,000 per year.
No senior should ever have to choose between whether they are able to fill a prescription or fill their refrigerator with food. But for you, yes.
They're now using the power of Medicare to negotiate directly with drug companies to bring down the prices.
And specifically when we talk about lowering prescription drug prices, one thing that comes up in particular is insulin prices, which is something obviously that affects many Americans who have diabetes. Can you talk a little bit about why the price of insulin is such a big part of this policy debate?
The high price of insulin has become a proxy for the broader fight around high price of drugs in America. This became a national issue in part because of the presidential campaign of Bernie Sanders.
The pharmaceutical industry itself has become a major health hazard.
He called a lot of attention to it on the campaign trail and continued to do so when Donald Trump was in office.
By far, the highest prices in the world.
The cost of insulin should not be so high. It's not a breakthrough drug. It's been around for decades. There are countries just across the border, like in Canada, where the cost of insulin is a fraction of what it had been in America. So Donald Trump first moved to try and cap the price of insulin for some people at $35 per month. It was a pilot project, didn't stick. Under the Biden administration, the federal government has moved to cap the out-of-pocket cost of insulin at $35 per month for seniors who need it, which I believe there are about 4 million seniors who need insulin, and then also pushed the private sector to do the same for other Americans too, who might need insulin. So insulin costs vary widely, but before this effort, people were paying $70 per month for insulin, at times even hundreds of dollars if they were in particularly dire circumstances. It has been a real change for those Americans, and it also is one of the real drug price changes that resonates in polling. It's not clear whether Donald Trump would keep those efforts begun by Biden, even if he agrees, even if President Trump for 4 years was pretty critical of the pharmaceutical industry. He has been very willing to abandon efforts begun by Democrats and try and do it himself. So these initiatives that have been begun over the past few years would continue under Harris, unclear what would happen under Trump. I think another thing that is different between the two candidates, Kamala Harris talks a lot about an opportunity economy and trying to lower costs for the middle class and poor Americans by taking on things like medical debt. We're removing the burden of debt for people who were unable to pay their medical bills. The Trump administration didn't do very much on that. Donald Trump as a candidate hasn't talked very much about that. But Kamala Harris is trying to center ideas like that in her presidential campaign.
And one new idea that she's laid out this week is expanding home health care for seniors, a Medicare at home proposal that would have the federal government paying for staff supports for people to get care at their homes. This has been an area of much stress for older Americans and their families. But then the question is, how would you pay for it? The Harris campaign says that negotiating with drug companies around Medicare prices would be enough to cover it, but there are real questions as to whether that would be true.
Dan, what's interesting in hearing you describe some of this is that it feels like a lot of these issues, specifically when it comes to health insurance and how much people are paying for healthcare, that there are things that Americans agree on, right? Like we all think that prescription drugs cost too much and that we should not have to pay the prices that we're paying for them. And so I wonder, like, what's the right space there in terms of where the Harris campaign is and where the Trump campaign is? Because it seems like, especially when it comes to like lowering prescription drug prices, that's something that Trump wants to do too.
Martine, Republicans absolutely think that healthcare can be their issue too. I have talked to people like Joe Grogan, who led domestic policy under the Trump administration, or Brian Blase, who was a top policy advisor, who say this is something that Republicans should be able to win elections on, that Donald Trump did try to take on the pharmaceutical industry. that Donald Trump did try to move on things like chronic disease and could do so again in a second administration. I think what's harder to square is that Republicans don't have the track record here that Democrats do. It's the Democrats under President Biden who have enacted these drug price reforms. It's the Democrats who have, during the COVID pandemic, for better or worse, aligned themselves with public health agencies that Republicans are now critical of. So while this could be a bipartisan issue, it has increasingly been more and more aligned with the Democrats.
And I think that's borne out by the polling. If you look at where voters land on who do they trust more on healthcare and on reproductive rights, Kamala Harris has a pretty big advantage. On abortion, she has nearly a 20-point advantage on trust with voters. And on healthcare costs, she has about a 10-point advantage over Trump. And that's very different than on issues like the economy or immigration, where she trails Trump. And I'm getting those numbers from the most recent tracking poll from KFF.
Well, I just want to dig into this issue of lowering healthcare costs a little bit more, because you said that Trump had tried but was unsuccessful while he was president to achieve some of what the Biden administration, now Harris, is trying to do. What is Trump saying about how he would actually lower drug prices, or what is he saying he would do going forward that would be different or more successful than his attempts in the past?
If I can be honest, he's not saying anything that's so clear. We don't know for sure what Trump would do in a second term. There have been some ideas floated by him or by his allies.
And what President Trump has told us is he's not scared of anybody. He said, I'm not scared of pharma.
He now has Robert F. Kennedy Jr. as an ally and endorser, and Robert F. Kennedy Jr. has talked about some of the things that he would like to do to the healthcare system.
And one of the key parts of that legacy is to make America healthy again.
Making Americans healthy again. But Donald Trump has been a little bit more of an enigma policy-wise compared to where he was 4 years ago, 8 years ago, when he was running on more definite policies and plans. There is a record, though, of what Donald Trump did as president. We can use that as a proxy.
After the break, we examine that Trump record Dan is talking about, specifically on the Affordable Care Act. We'll be right back. Dan, I want to come back to talking about health insurance and specifically the Affordable Care Act. I really like the way that you put it, that it feels kind of like Groundhog Day, because ever since the Affordable Care Act became law, it seems like there have been existential threat after existential threat to the survival of this thing, and yet it always survives. And of course, even during the Trump administration, it came pretty close to repealing the Affordable Care Act, but it didn't happen. And at this point, it seems like this is actually relatively popular among Americans. So tell me about why Trump continues to attack the Affordable Care Act and whether the ACA really is a threat if Trump becomes president again.
You know, when I first started as a reporter in 2016, I wrote some headline in a newsletter. If at first you don't succeed, try. And I counted however many times Republicans had tried to repeal the ACA at that point, which I think was like 45.
What?
Yeah. So there were a lot of tries in that headline. Why were Republicans so insistent? Why was Donald Trump so insistent on campaigning on this message? I think because it worked. People were unnerved by the idea that the Affordable Care Act was going to make major changes to their healthcare access. President Obama vowed that if you like your doctor, you can keep your doctor, which isn't true even before and after the Affordable Care Act. Your doctor sometimes can't be kept if your health plan changes or your doctor moves in and out of your coverage area. So I think the Affordable Care Act became a convenient scapegoat for people's fears and concerns about American healthcare, which was screwed up a long time before the Affordable Care Act. And there are things in the ACA that at times did make things worse. Some Americans did have a problem getting access to cheaper health plans. They had these kind of skimpy, very limited plans before the Affordable Care Act. Those plans were effectively outlawed. And the new plans, at least initially for some Americans, were more expensive. So people got upset about that. And Donald Trump picked up on those tensions very early. I went back and looked at some of his tweets right after the ACA was passed. And he was tweeting probably hundreds of times in tweets and in speeches and videos talking about how bad this law was and how it needed to be repealed. Then came a moment where it looked like that would happen. Republicans controlled Congress. Donald Trump was in the White House, and they were very, very close, one vote away in 2017 from finally overturning the law. But it became very clear throughout that process that Republicans did not have a health plan that would cover as many people as the Affordable Care Act, or do so at as low a cost as the Affordable Care Act. So the effort died and has not really been resuscitated.
Well, it's interesting that here we are 7 years later, and when Trump is asked about what he thinks a right healthcare plan would look like during the presidential debate, that he talks about having concepts of a plan, but really no details, or it seems like no plan at all. So I guess, like, is this still a winnable strategy for him to threaten to take down the Affordable Care Act now, given that it's 7 years later, and I think people have a different relationship to the Affordable Care Act, and people just assume that it's going to be in place?
I think you're hitting on the core issue, which is this has not become a winning issue for Donald Trump. It has become the winning issue for Kamala Harris and Democrats. When Donald Trump said at the debate that he had concepts of a plan, that wasn't what he led with. That was after moderators pushed him.
If we can come up with a plan that's going to cost our people, our population, less money and be better health care than Obamacare, then I would absolutely do it. But until then, I'd run it as good as it can be run.
So just a yes or no, you still do not have a plan?
I have concepts of a plan. I'm not president right now.
Republicans realize this is not going to be something that they can convince Americans on after their repeated failures to actually repeal the Affordable Care Act. But Democrats are tapping into Americans' anxiety about this law going away, a law that now covers tens of millions of Americans, a law that has provided new protections for people with chronic illness. Kamala Harris and her allies keep talking about how Donald Trump wants to strike down the Affordable Care Act, wants to get rid of it. He hasn't said that so explicitly this time around, but he certainly talks about how much he dislikes the law and how, man, he wishes he could change it if he gets back in office again.
Though I think this is also where Senator and Vice Presidential candidate J.D. Vance comes in, because he has been talking in a little bit more explicit terms about changes that he would want to see in the healthcare system if he and Trump were to win the election. Can you talk a little bit about what we've heard from Vance and what the potential pluses and downsides are for some of what he's proposed?
Martine, it is fascinating to me that J.D. Vance, who was not in Congress during the Affordable Care Act fight to repeal it, and also criticized the Trump administration for trying to repeal the Affordable Care Act, that he has now become the effective spokesperson for what Donald Trump would do to change the Affordable Care Act. He has said in recent remarks, he elaborated a little bit at the debate, too, that the Affordable Care Act has not done a good enough job of providing choice, of providing alternatives to Americans who might not be chronically ill and want to have health insurance but don't want to spend as much.
We're going to actually implement some regulatory reform in the healthcare system that allows people to choose a health care plan that works for them.
There is some truth that the Affordable Care Act pushed us all together to ensure that chronically ill Americans could get access to coverage. The younger and healthier Americans are now increasingly cross-subsidizing those sicker Americans. We're kind of all in the same pool, the same bucket. J.D. Vance has floated the idea of breaking us up into separate pools. There could be the creation of a high-risk pool, which was a model that was in effect before the Affordable Care Act, where sicker Americans might be grouped together and have a different health plan that might cost more in order to access coverage. It's still somewhat unclear what that would look like. J.D. Vance has talked about this on TV remarks. He elaborated a little at the debate. There has not been a formal proposal from the Trump campaign, but you can see the outlines of what Republicans want to do in some of these other proposals that have come out from, say, the Republican Study Committee, this influential group in Congress, or Project 2025, which has talked a bit about wanting to change the insurance markets and create more flexibility for younger, healthier Americans. Donald Trump has repudiated Project 2025, which he said, this project by the Heritage Foundation and other conservatives doesn't speak for him, he says. But the people who drew up these Project 2025 plans are largely former Trump alumni or would be in a second Trump administration.
And I think that has raised some eyebrows because obviously there would be potential benefits for those younger, healthier Americans and that they would potentially have cheaper insurance, but also I think has raised a lot of fear among people with pre-existing conditions or chronic conditions, worried about like what would it look like if a Trump-Vance presidency tries to put in place this new healthcare where they are in their separate group with other sick Americans and that they all kind of have to pay a lot more.
That's totally right. I was speaking to some analysts who have looked at the number of Americans with pre-existing conditions. By some estimates, that's over 100 million people. So there are a lot of folks who remember the pre-Affordable Care Act times of struggling to find a health plan, or maybe you get a health plan, but your chronic condition is excluded and you have to pay out of pocket for it. People don't want to go back to that. And the Trump campaign does realize that. They talk about the changes they want to make to the Affordable Care Act, but stress, we're going to protect pre-existing conditions. But it's unclear, once you start changing the regulations here, what would that actually look like? And would people with chronic illness lose out with more expensive health plans or be facing new barriers that don't exist today?
In terms of what we're hearing from the Harris campaign, is it essentially that, yes, the Affordable Care Act is great. We all like Obamacare and we'll protect it and keep it in place. And like that's the kind of beginning and end of their stance on that. Or are there things that even Harris and Walz would want to change or maybe in their view improve about the Affordable Care Act if they were to win?
Well, that's a good question. Well, first, it's notable that Kamala Harris is wrapping herself in the Affordable Care Act because when she last ran for president, she first wrapped herself in the idea of Medicare for all, the very liberal proposal backed by Senator Bernie Sanders to get rid of private health insurance and put all of us on government health insurance. She was the first senator to co-sign Bernie Sanders' proposal in 2017. And then Kamala Harris came out with a modified Medicare for all proposal in 2019 that would have preserved some private health insurance. But she has since repudiated that and now really is all in on the Affordable Care Act, says that this is the model to build on. There are some things to the Affordable Care Act she does want to change, Martine, or at least make permanent. During the Biden administration, there were more generous subsidies to many Americans if they wanted to shop for healthcare through the Affordable Care Act insurance exchanges. Joe Biden, Kamala Harris want to make those subsidies permanent. The Trump campaign has signaled that if Donald Trump is elected, those subsidies would likely change or even go away.
So zooming out, and when you think about the differences that you've outlined in terms of where the Trump and Harris campaigns are and on various healthcare issues, what do you think is at stake here, depending on who wins?
I think the stakes are significant for some parts of the healthcare system. On reproductive rights, Donald Trump has a record of cracking down on abortion access. He was so effective at it that the anti-abortion movement said he was the most anti-abortion president in history. And even though he has recognized in this campaign that abortion access could be a losing issue for him, and he's tried to back away, we have to look at what he did for 4 years and the possibility that he would try and crack down further, or at least the people around him would. So I think that is a major change. The idea that the federal government should be negotiating drug prices directly with the pharmaceutical industry, that could come to a halt. Even if Donald Trump supports that, he might want to rip up what the Biden folks have done and start anew, so that could delay things. And then there also are real changes afoot, I think, to the federal government's health bureaus. The Centers for Disease Control, the Food and Drug Administration, these are agencies that under the Biden administration were relatively hands-off by the White House, which had seen during the COVID pandemic how the Trump administration really stepped in and tried to shape the messages of those agencies. I think if Donald Trump returns to power, there are a lot of people in his orbit who want to crack down on those agencies, who want to overhaul them, change their messages. So that could be a very different approach if he's elected.
Dan, thank you so much.
Martine, thanks for having me back.
Dan Diamond is a national health reporter for The Post. Some of the tape you heard was from the William J. Clinton Presidential Library. Before we go, just want to share some updates about the damage from Hurricane Milton. First, there were more than a dozen tornadoes in parts of Florida. Then, on Wednesday night, the storm made landfall south of Tampa. According to Florida officials, at least 7 people are dead. At the time of our recording, more than 3 million people have lost power. And the storm shredded the roof of the Tampa Bay Rays baseball stadium. The stadium had been turned into a 10,000-person base camp for emergency operations. We're going to keep following this story, but in the meantime, if you want to check out more updates, go to WashingtonPost.com. And
the Royal Swedish Academy of Sciences has today decided to award the 2024 Nobel Prize in Physics to John Hopfield, Princeton University.
Throughout this week, we've heard announcements about the recipients of the Nobel Prize.
The Nobel Prize in Literature for 2024 is awarded to South Korean author Han Kang.
I love hearing about these announcements every year. Of course, learning about the amazing and innovative work that's happening in chemistry and physics and medicine, but also because it's just so fun to hear about the moment people find out that they've won a Nobel Prize. That call they get, sometimes in the middle of the night, with news that is about to change their life.
Well, an utter surprise. What were your first thoughts?
My very first thought was, how could I be sure it wasn't a spoof call?
And how could you?
It was coming from Sweden, and the person had a strong Swedish accent, and there were several of them.
Yes, so it would have to be a posse of impersonators, which is unlikely, I suppose.
Yes.
That's Geoffrey Hinton, who won the Nobel in Physics for his pioneering research in artificial intelligence. He was interviewed by an official from the Nobel Prize Outreach Organization. Throughout the week, Nobel has been releasing these interviews with recipients just shortly after they got the news. This one was with David Baker, one of the people who won the Nobel in chemistry, also for his work in AI.
Can you just tell me how the news reached you?
Let's see. Well, actually, I think it's kind of funny. I didn't realize this till afterwards, but I think they had the phone number for my son, who then gave them my phone number, and so I got a phone call. And my wife promptly started screaming, so I had a little hard time hearing. But then they got the news across.
I like that she twigged before you did.
Yeah.
The one that I found most relatable was the interview with novelist Han Kang, the first Nobel laureate in literature from South Korea. That prize was announced earlier today.
Do you have any ideas on how you will celebrate this Nobel Prize?
After this phone call, I'd like to have tea with, I don't drink, so
okay.
I'm going to have tea with my son, and I will celebrate it quietly.
Those phone calls came courtesy of Nobel Prize Outreach. The Nobel Peace Prize will be announced tomorrow, and economics is on Monday. That's it for Post Reports. Thanks for listening. If you're looking for the latest updates on the big news of the day, including new developments about the aftermath of Milton, check out our morning news briefing, The 7. We bring you through the 7 stories that you need to know about every weekday morning by 7 a.m. You can listen to it wherever you listen to podcasts. Today's show was produced by Alana Gordon with help from Rennie Svirnovsky and Emma Talkoff. It was mixed by Sean Carter and edited by Rena Flores. Thanks also to Stephen Smith. I'm Martine Powers. We'll be back tomorrow with more stories from The Washington Post.